Good evening. My name is Chris Power. I've entitled my talk this evening, If You're Riding a Horse and It Dies, Get Off. I stole this title shamelessly from a book that was written about the education system, actually, but I think it has a lot of relevancy for healthcare, not only in Nova Scotia, but across this country. This book demonstrates all the ways in which we try to figure out how to breathe life into a dead horse. It's quite simply died. In the book, they strike a committee to study the dead horse, they try a different saddle, they try resuscitating it, they blame it on the parents, they put wheels on it, they say we need federal funding to bring it to life. It goes on until somebody decides to do something different, and in comes the car. For those of you who work in the healthcare system, and for those of you who've experienced it along the way, I'm sure you may see some similarities to our current system. For years, we've done the same things over and over again and expected different results. But if the horse is dead, the horse is dead. So how do we simply get off that horse that's been so loyal to us and has served us so well in the past but no longer does? And with what do we replace it? Canada used to hold an esteemed place on the world stage for our healthcare system. People came from far and wide to study it and emulate it. But in 2014, the Commonwealth Fund compared 11 peer countries on a number of indicators on health system performance, and Canada rated 10th out of 11, second only to the United States. Canadians believe that our healthcare system is in crisis. I don't think it's in crisis, but I think it's in stasis. We are standing still in some instances, and Medicare is aging badly. Although when surveyed, people believe that our healthcare system is safe, every 17 minutes a Canadian dies in a hospital in this country from a preventable adverse event. Those are things like medication errors, infections, misdiagnosis. In the United States, this number is 575 people a day. It's the third leading cause of death in the United States. This past year, I had the wonderful opportunity to serve on the Federal Health Innovation Panel. Our mandate, which was given to us by the then Federal Minister of Health, Rona Ambrose, was to identify the 5 most promising areas of innovation in Canada and internationally that have the potential to reduce growth in healthcare and improve our health outcomes, and then to recommend 5 ways that the federal government could support that innovation. We talked with hundreds of people from all walks of life, from every province and every territory and internationally, and we had over 400 written submissions, and what we heard was somewhat sobering. We saw pockets of excellence throughout this country. There are some amazing things that are happening, but there is no spread and scale of these ideas and practices. We heard from people who weren't beaten, but they were so tired of trying to make change. They hit so many speed bumps and sometimes brick walls in their efforts to really create sustainable change. We heard that the federal government had seemingly taken a pass on investing in health care, and provinces were eager to have them come back to the table. We heard many ask for an investment of federal funds to help spark innovation. There were a multitude of committees and task forces had been struck in the past to study the problem and offer solutions to our aging system. Sound familiar? So what will be that silver bullet that's going to change our system and put us back on the world stage? So here's the news flash. There is no silver bullet that's going to change our complex system overnight, but there is hope, and there are many things that we can do for change. The 5 recommendations that came from our panel are, number 1, patient engagement and empowerment. Huge. We've got to engage patients in a different way. Health systems integration with workforce modernization. We are not even integrated within hospitals, let alone within our provinces and within this country. Technological transformation via digital health and precision medicine. Better value for procurement, reimbursement, and regulation. Where's the return on investment? And industry as an economic driver and innovation catalyst. We heard from industry how frustrated they were in trying to move innovation forward in this country. So I'm going to offer you 3 ways in which I believe we could fundamentally change the healthcare system. There are lots of other ways. These are just ones that I chose. 2 of them are enablers for change, and one is a fundamental shift in the power dynamic that's alive and well today in healthcare. The first one is precision medicine. The science and technology exist today to map our genetic makeup, and this will, when fully implemented, improve the way in which diagnosis and treatment is delivered in spades. We have incredibly bright minds in this country who are working on this now and are world leaders in their field. What's missing is a strategy to implement these concepts into frontline care. For instance, when a doctor prescribes a medication for you, he or she has no way of really knowing how you'll respond to it or even if you'll respond. In some cases, it can even harm you. Knowing your genetic makeup, the technology is there to help your doctor know exactly what will work for you, preventing adverse events. If we started with just two things, pharmacogenomics, that's how our bodies react to medications, and cancer diagnosis and treatment, we would advance in leaps and bounds. The second area is a robust mobile health technology. The vast majority of our healthcare takes place in the community, yet all our time, most of our time, energy, and resources goes to hospital care. We live in a digital world that has solutions for almost everything, including e-health, yet we've not invested in these areas. Not so long ago, I was at a conference where somebody was telling us about a new hospital that was being built somewhere in the world that had no beds, no emergency departments, no operating rooms, no diagnostic theaters, no clinics. Instead, what this was a building with healthcare professionals, huge screens where they were interacting virtually with patients and people, citizens, where they worked, where they lived. This is the hospital of the future. It's here. We need to catch up. And last, but most importantly for me, the biggest innovation is a health care system partnering with patients and families. It's not rocket science. Nothing about me without me. Demand the care you deserve. Settle for no less. Be ever vigilant. Ask questions. Listen deeply. Good health care starts with good communication. You have the power to change it. Be an active consumer. You wouldn't buy something important in your life like a new car, a house, or a business as a passive bystander. You simply wouldn't. You would research it, you'd test drive it, you'd understand the safety features, you'd buy extended warranties. Use the same vigilance in your health care. You're in the driver's seat. Take charge. Be an active participant. Have the courage to insist on change and be part of that change. And I'm just going to end with a poem on change because this is what this is all about, innovation, sources unknown, I wish I could give them credit. If you always believe in what you've always believed, you'll always feel the way you've always felt. If you always feel the way you've always felt, you'll always think the way you've always thought. If you always think the way you've always thought, you'll always do what you've always done. If you always do what you've always done, you will always get what you've always gotten. If there is no change, there is no change. Thank you.